Meanwhile, the NICD's Dr. Juno Thomas says that the local cholera cases are of much higher concern to the country than those that have an imported link. She says it indicates that there is a local transmission. It's very likely that there may be other cases that have not been identified. Thomas says that the NICD has been monitoring Africa since late last year and that the SABC region is obviously struggling with the management of the outbreak. Right, so staying on the story, the World Health Organization, Professor Walid Ammar, says that a growing number of health emergencies around the world, from COVID-19 to cholera, have left the World Health Organization's response overstretched. Perhaps to take this discussion further, we're going to be joined via Zoom by Chief Communication and Partnership for UNICEF South Africa, Toby Fricker. Toby, good afternoon. Thanks for your time with us here on the SABC.
Good afternoon. No, thanks so much.
Perhaps you could just talk to the reality on the ground for the World Health Organization on providing aid and services, just given the scenarios unfolding, perhaps both pre and post COVID-19, and the spread of cholera that obviously has more cases being reported as we speak.
Yeah, absolutely. We are seeing, this big spread of disease more broadly, transmission of diseases like measles, like mumps, like diphtheria. And some of those have come about due to the lower immunization rates in South Africa, but also globally. And obviously that's a massive concern, that we need parents and caregivers to get their children vaccinated. These are preventable diseases that they can get routine immunization for. And now we're seeing this cholera outbreak. But it comes at a time where we're actually seeing 25 countries globally have declared cholera outbreaks since the start of 2023, and that's very high. You mentioned the Southern Africa region, and there's an outbreak in Malawi, which had a high rate of deaths, actually 3 in 100 cases, which is high for cholera. It should be more below 1, ideally. And now we have this outbreak in South Africa as well, where we've seen 15 deaths more recently, and that includes 2 children, which is particularly concerning because children are the most vulnerable, as we say, because their immune systems are not fully developed. And when you catch cholera, when you're infected by cholera, that really leads to acute watery diarrhea. It leads to rapid dehydration. And that's why it's so important that parents and caregivers understand the signs and can then get access to treatment to health facilities as quickly as possible.
Toby, with the changing demands, issues with resources, new challenges coming to the fore, perhaps you could speak to the work by the World Health Organization. I mean, it's obviously spread across the world, some incidences that, the services that you're offering, the aid as well. I'm asking this just because I want to look at World Health Organization at large and how it's equipped for these changing dynamics.
Yeah, well, I work with UNICEF in South Africa, and of course we are part of the UN system. So we work very closely with the World Health Organization, and most importantly in South Africa, we work with the United Nations in South Africa. So under the leadership of the Resident Coordinator's Office here in South Africa, we're actually gathering with all the agencies. That includes the World Health Organization, it includes UNICEF and others, to really help to strengthen the response when we get these outbreaks like we're seeing now with cholera, but also on, as I mentioned, on other issues to strengthen that routine immunization. So UNICEF, for example, have received support from the governments of Germany, of Japan, to strengthen the cold chain management system in South Africa. And that's important because it's a systems approach that can really provide that long-term support to improve vaccination, to improve the ability to quickly distribute vaccines across areas where they're needed most. And in cholera, UNICEF has a global mandate on water, sanitation and hygiene, and that's very critical and absolutely vital to prevent cholera in the first place, but also then to slow spread as well. So working on communication and community engagement, we aim to really engage with communities to provide that, what is essentially life-saving information to stop the spread of diseases like cholera, but also to encourage parents and caregivers to get their children vaccinated against preventable diseases.
Toby, you spoke about low vaccine uptake. I just wanted to look at some of the challenges, even the contributions that perhaps women face at this point.
Yeah, absolutely. I think there are many challenges. I mean, UNICEF released the State of the World's Children report that focused on vaccinations, childhood vaccinations, and we see many factors come in. Some are around a decline in the confidence on vaccines. So COVID really opened this sort of wave of concern over vaccines. Some of it understandable because COVID vaccine was very new. People were scared about taking it. But what people didn't look at is the history of childhood immunizations and how they've saved millions of lives over history. And that's absolutely key, that they really can save children's lives, which is why it's so important that the Road to Health booklet, for example, here in South Africa, is closely followed. And for women, for caregivers more broadly, to really keep up to date with the Road to Health booklet and make sure their children get vaccinations. But there are many challenges, and that includes costs. So, and when I say costs, I mean that access to health facilities. I've met people in Umlazi and other areas who told me that they wouldn't be able to go and get the vaccine from a health facility because they can't really prioritize the taxi to go somewhere. So it's about bringing services to the community as much as we can, acknowledging that is can be a tough task and is expensive as well.
Toby, I'm just reading an article that was published on the 22nd of May, where it was cited 2 children were amongst the cholera deaths in Gauteng province. A cholera outbreak spreads, threatening the health of children and people across affected areas, and UNICEF South Africa stands ready to further scale up its support. As we speak, what does that look like? I'm asking this because obviously the NICD was presenting, and poor border management across the African continent was cited as a reason, and I wonder how you'd weigh in on that, given what you're facing in relation to children, but also in just containing the situation, looking at the root cause of where it's coming from at this point.
Yeah, absolutely. I mean, there's 2 key things right now. Number one is really getting to the source of the outbreak. And I know the Department of Water and Sanitation, working closely with the Department of Health, are on the ground, are doing that research, trying to find out where exactly the source is. And what's absolutely vital is what UNICEF has been advocating for, both in South Africa, but more globally, is really that investment in water and sanitation systems, because that is what really stops out cholera outbreaks in the first place. So it's absolutely critical that we can improve those systems to everyone, to informal settlements, to everyone in the country. The second thing is UNICEF is working with the Department of Health to improve what we call the risk communication and community engagement. And that means access to information at a community level. So it's telling people, what are the signs of cholera? What can you do to help prevent it, such as boiling water, even for women with young babies, to breastfeed, to not use formula and mixing that with water, which can then lead to cholera. So making sure that they exclusively breastfeed, which is the best nutrition for children anyway. And it's really providing that information as much as we can, particularly targeting communities where people are affected, of course.
Toby, just very quickly before I let you go, I want to look at the state of the mental health, perhaps, of volunteers, workers, and those affiliated to the World Health Organization, UNICEF, at this point, just on the back of COVID, given some of the other challenges that we're facing within the healthcare system globally?
One thing we sometimes forget is that the World Health Organization, UNICEF, but also the partners we work with very closely, and that's community-based organizations, that's NGOs on the ground who live in communities that are most affected. Let's not forget that there's no separation between people who work on the ground with the communities. So they're equally affected. And I think it's really important that duty of care to staff, to UNICEF staff, but also particularly to our NGOs, to community-based organizations who are on the ground, who are tackling these issues day in, day out, receive the care that they need as well, because they are also directly affected. And that's one thing that I think is absolutely vital, that they're provided with the space to be able to cope with and deal with any challenges that they face at a community level.
Toby, thank you for your time with us here on the SABC, for being part of that conversation. Toby Fricker is the Chief Communication and Partnership for UNICEF South Africa. Really just weighing in on the interventions that have been put in place to assist, collaborate and communicate alongside NGOs and other stakeholders with government to monitor the situation, of course, that's happening with the cholera outbreak. Perhaps also look at some of the interventions that are needed and where to from here. Also touching on the organization's role to date and how it's been able to navigate in a world pre and post-COVID. So again, thank you to him for his time, and we'll leave that conversation there.